Hi, I'm Dr. Mark Miller. I want to visit with you for just a bit on what makes our office different. In other words, most all of our clients prior to coming to us have been to other doctors, other medical doctors, chiropractic doctors, and they're not getting the results they're looking for. They come in here and they get what they're looking for. So what makes us different is what I want to share with you. And I'm going to go into a little bit of detail about exactly what makes us different and why we get the results that you're looking for. I'm going to go over just a few things to begin with, what makes us different. What we do in this clinic, we do what are called brain-based and central nerve system therapies. So after we do our evaluations on brain and central nerve system function, we then have specific therapies that we do that cause improvement in brain and central nerve system function. That's huge. The other thing that we do is the structural analysis of the spine, the pelvis, how our what's called our axial skeletal system is lined up. That's huge because the brain, the tail of the brain is the spinal cord. Well, that spinal cord goes down through the spine. So any misalignments in that spine system can cause pressure on those nerves that come off the spinal cord. And of course, those nerves, I'm going to talk about more in detail, but what those nerves are doing, they're taking the messages that start and originate in the brain and go down the spinal cord and travel over those nerves. Those messages go to every organ, every gland, every muscle, every tissue, every cell gets information that comes from the brain. So the brain central nervous system and the spine function very harmoniously together. And when conditions that abnormally affect brain, central nervous system, and spine occur, all that pain and suffering that people come in with, that's the result of that. So our evaluations and then our treatment is geared towards clearing out misfirings in the brain, abnormal function of the central nerve system, and any misalignments in the spinal structures. The other thing that we do is we teach our clients how to be responsible for their problem, because it is your problem or that client's problem. So we teach our patients how to take responsibility for it with what is correct posture, what are the secrets to correct posture. So at any given moment, our client can do a postural check and know whether or not they are in fact in correct posture. We also teach what we call our miracle exercises. I call them the miracle exercises because literally they take like 10-15 seconds to do. But what they do is they force normal motion back into the spine system. And through that normal motion, we get normal fluid exchanges, feeding and cleaning of those tissues. We also do very progressive type of therapies that are referred to as oxygen-based therapies. Now, oxygen-based therapies are designed to get the centers of the brain firing correctly so that the message leaving the brain that's fired into the spinal cord is correct. So then as those messages travel over those nerves to various muscles, organs, glands, tissues, that message is correct too. So it's a whole person approach. We also have very specialized forms of physical therapy that we do. All of our therapies are designed to get the spine and central nerve system functioning at its optimum. When we attack, if I can use that word, a condition, we attack it from 5-6 different angles. And that's how we get the quick results we get. And as you we'll see as we go along here, it's all very understandable, and I'm going to break it down here and show you individually what those things look like. So let's just visit for a bit here on how the brain and central nerve system works. The hindbrain, called the cerebellum, it fires into the cortex. Cortex then fires back into the center brain, the mesencephalons, the pons, and the medulla. The center brain inhibits the message coming from the cortex if it's firing correctly, so that the message then fired from the brain into the spinal cord is the correct message. When there is an oxygen deficiency in the system, the frequency of firing of those centers can be impaired. So now the message that's fired into the spinal cord is too much. So if there's too much message coming from the brain down that spinal cord, it can adversely affect all organs in the body. It can adversely affect the muscles running along the spine. A lot of our clients will come in with those muscle spasms. It can contribute to scoliosis. It can contribute to degenerative disc disease, because as those muscles tighten up, it interferes with the normal motion of the spine itself. Well, as you interfere with the normal motion, you interfere with the normal feeding and cleaning of the disc and the tissues along the spine, and that's associated with degenerative disc disease. So once we've assessed that, then we set out to make corrections. Now, one of the instruments that we use in our clinic is a special instrument called an oximeter. Now, that's a fancy word that measures oxygen levels in the system, and it measures levels of oxygen in two areas: the vascular system and then in the tissues. It uses infrared technology that came out of 2007, 2008, so it's very advanced technology. Now, the other thing that we do with regards to the spine is we do an evaluation of the spine, so we can determine at what point the nerves are malfunctioning. Now, I want to go over just briefly how your spine's working. This is what a normal segment of the spine looks like. Here's the disc, the vertebra, the disc, and so on. These are the nerves. Those nerves come off the spine, they exit in between the vertebra, and it comes off both sides of the spine all the way down. Well, here's what can happen. When that vertebra misaligns, you can see that nerve. Watch what happens. It puts pressure on that nerve. Well, if that's not corrected, that pressure on the nerve will just continue to fire abnormally. That nerve, the messages, like I said, the messages traveling over the brain, going to every muscle, every organ, every part of your body. When pressure is put on the nerve, it blocks part of that message, aggravating the nerve. Now we have a spine-related problem in addition to a brain central nerve system problem. So the whole thing needs to be properly assessed. Many doctors, whether it's a medical doctor or a chiropractic doctor, do not evaluate that entire system the way we do. So once we find out where exactly that problem is and we make that correction, then the pain, let's say the nerve was going to the headaches go away. Let's say the problem was more into the neck and going into the arms, but it's the same nerves that go into the heart and lungs. And a lot of times people will come in with neck pain but also have asthma or high blood pressure. Those are both indications that the nerves and the systems are not working correctly, the heart and lung systems. Or maybe it'll be a problem in their middle back. Their pancreas isn't working right, so now they have a diabetic diagnosis. Or the stomach's not working correctly because of pressure on the nerves. Now they've got epigastric reflux or indigestion, those type problems. Or it might be something lower in the back, so now kidney and bladder are malfunctioning. Or even the old sciatic nerve problem, which we see so many of. And that's pressure on those nerves going into the lower spine. So you can see that brain and spine problems can adversely affect the entire system. And if we only correct part of the problem, then you can see there's going to be an incomplete correction. Well, in our office, we address the entire condition: brain, central nervous system, and spine. We use chiropractic procedures, very advanced. You know, I taught at the college level back in 80 and 81. And so I have a specialty in chiropractic that I have developed that specifically lines that spine up. All of our physical therapies are designed to get the spine back to its optimum function, improving the function of the central nerve system. We do things that other doctors do not do, and we get results that other doctors do not get. And our clients have seen 2, 3, 5, 7 other doctors before coming to us, and then they find the results they're looking for. I hope we have the opportunity to assist you in your healthcare needs. So we have a special offer. Part of our community outreach, first 2 visits, total cost just $77. That way you can find out what the brain, central nerve, and spine systems are doing. X-rays, all those exams, just $77. Give me a call. I'd love to talk to you about your healthcare needs. I'm Dr. Mark Miller.